Senator Sepulveda, thanks so much for being on New York Now this week.
Thank you so much for inviting me. Happy to be here.
So we had our first hearing this week on the state's handling of nursing homes during the COVID-19 pandemic. Obviously, there's going to be one next week as well. But I wanted to talk to you about a bill that you sponsored, and just to backtrack a little bit, in March or April, the legislature passed legislation that granted these blanket legal protections to nursing homes and healthcare facilities, and you had a bill that passed in July that rolled them back and really narrowed them down and limited them. Tell me, if I'm somebody going to a hospital or one of these healthcare facilities, how that's going to change my experience there.
Well, that means that now that we have more information, more available science about the way the COVID-19 disease is spread and the standards of care that the hospitals can now use, they understand now how the virus functions a little better than it did back when we passed the budget and we gave that unqualified immunity to the nursing homes, let's say, in the hospitals. Now that we have that information, the nursing homes, the hospitals, they are better able now to prepare incoming patients, incoming seniors for their nursing homes, and take the correct measures that will protect them from being infected inadvertently with the coronavirus. So since we have all that information, we felt that giving a complete unqualified immunity to these health facilities was no longer warranted. Now that they are in a position to be able to understand the virus and take precautionary measures, that there's no reason why they should be forgiven if they violate the standard of care or outright negligent in their treatment of patients or seniors at nursing homes.
I know it's hard to look back a few months ago when you were first passing that legislation as the legislature and the governor as part of the state budget, but do you think, knowing what you know now, that it was a mistake going in, or is that impossible to say?
Well, it's impossible to say. I mean, hindsight is always 2020. The opposing view of those who didn't want to give any level of immunity and the views of the hospitals are diametrically opposed. The hospitals were concerned about, if they suddenly get swarmed with lawsuits, then there may no longer be hospitals in those locations. They'd have to close down, or they'd have to file for bankruptcy. So there was a serious concern that during a crisis like that, we didn't want to put hospitals in that situation, or even nursing homes in that situation. So we didn't know what we were facing. And to some degree, that justified the drastic measures that we took.
So shifting to a different but related topic, you had another bill that passed that allows the Correctional Association, which is a prison watchdog group, give them new powers. They can now visit state prisons unannounced. They can interview people that are incarcerated and correctional officers. Tell me the intent of that bill and what kind of transparency you're hoping to provide to the state's prison system through that.
As the chair of the Corrections Committee, I've been extremely frustrated for the last couple of years about the lack of information that we receive from docs, certainly in real time. We've tried to have a working relationship with Commissioner Annucci, and I believe he does the best that he can. We try to get information about correctional facilities from the governor's office, and there's always a lapse in time, or the element of surprise no longer exists if we want to go to a corrections facility. I've always believed that the sunlight is the best disinfectant. If you want to see how the inmate or the persons that are incarcerated are treated, if you want to see whether the facilities are dealing with people as human beings and not essentially people that are less than animals to them, we want to make sure that people get treated with respect, even though they're incarcerated. And the only way to do this is if you have this level of transparency for an organization that's been around, nonpartisan, and has done an excellent job in terms of reporting what happens in our facilities. I've seen their reports, I've met with their leadership, and generally speaking, they're right about 100% of the time. But I want them to be even more right, because this way, with this law, they get more access immediately to any facilities they want to visit.
As corrections chair, I'm wondering how you thought about the state's handling of COVID-19 in the state's prisons. As of this week, we had 17 deaths in state prisons since the start of the pandemic, confirmed deaths at least. The toll may be higher, we just don't know. Some people will say, well, that is a low amount relative to the rest of the population. Others will say that even 17 deaths could have been prevented. What did you think of the response?
Transparency, information gathering has always been very difficult with docs. It was no different with this issue of the coronavirus. Um, I think ultimately we will find out as we gather more information whether their response was correct, whether the facilities acted appropriately. It's right now hard for me to measure exactly how transparent and how well of a job they did in combating the spread of the disease. I'm one of those who believes that 17 to 17 too many. However, under the circumstances, you give a little leeway to the people that are running it, but ultimately we will determine whether or not the response was correct. I can tell you right from my experience that getting information from them is frustrating. So in that level, I don't think they were successful. They still function, it's very secretive, corrections. DOPS is very secretive. It's another reason why I'm planning on holding hearings on COVID and our facilities in the immediate future. I know we had one on the nursing homes yesterday, and we're going to have a further one, but I also want to focus on the work that they did in our facilities and have hearings for that.
Focusing on the state prisons and the county jails, or more
All
of a
facilities.
broader sense?
All encompassing. Sometimes the worst actors are the local jails, the sheriff's departments. Sometimes they are the worst in terms of, they're certainly the worst in terms of giving information, but a lot of the mistreatment of people that are incarcerated comes from facilities that are run by sheriffs. So we're going to be all encompassing and looking at everything.
All right, well, we will keep an eye on it. Senator Luis Sepulveda from the Bronx, thanks so much for being here.
Thank you so much. Stay safe. It's windy out there.